Hello, and welcome to another installment of Lunch and Learn presented by Pelvic Health. I'm Dr. Allie, a pelvic floor physical therapist. Over the next few weeks, our series is going to be talking about urinary incontinence. For those that aren't familiar, incontinence is involuntary loss of bladder or bowel control. For the purpose of this talk, though, we're going to focus on bladder. This can also be referred to as urinary leaking or like leaking urine. That's how a lot of people, when they come to see me, that's how they describe it. So I thought this week it would be really helpful to start with how we urinate or pee. Keep in mind that this description is about what occurs in the body given that there's no underlying or external factors affecting that process, such as neurological disease or injury. If you fall into one of those categories and you want more information on how your medical history might be affecting your bladder, you can send me an email or a DM and we can talk more about it. So urination is also called micturition, which is the process of emptying the bladder. And here's our bladder. This situates kind of in that front part of the pelvic bowl, kind of situates a little bit behind the pubic bone, and is in front of like vaginal canal and uterus, and rectum is in the back. So just for that kind of anatomy review of where the bladder is. As the bladder fills, it stretches. This stretch is monitored by specialized receptors that determine when the bladder is full, so that when the bladder crosses that threshold, those stretch receptors send a signal to the brain and it says, hey, we're full. Signals are then sent back to the bladder and to the pelvic floor. If it's an appropriate time to go to the bathroom, the bladder will contract and the pelvic floor will relax, allowing urination to occur. The bladder muscle is also called the detrusor. This contracts involuntarily. This means that we can't actively control the bladder contracting. This part of the micturition reflex is controlled by the autonomic nervous system. We do, however, have voluntary control over the external urethral sphincter, which is how we can hold in our pee when it isn't an appropriate time to go to the bathroom, and we relax that area in order to let urine come out. And this is controlled by the somatic nervous system. So part of the process is involuntary and part of it is voluntary. Infants, for example, function under the involuntary control. It's more reflexive in nature, but as their body grows and develops, they gain control of that voluntary and inhibitory function that allows them to become potty trained. Because the voluntary portion of micturition is controlled by the external urethral sphincter, which is part of the pelvic floor, dysfunction to the pelvic floor can impair your body's ability to hold in urine before it's actually time to go. That could ultimately lead to leaking or incontinence. So factors like hypertonic muscles or tension in the pelvic floor, glutes or abdomen, things like prolapse, scar tissue from C-sections or tearing during childbirth, chronic constipation, pain, weakness, any of these factors can impact the micturition reflex and cause or exacerbate symptoms of incontinence. So as a recap for simplicity's sake, the bladder fills. Once it's so full, it sends a signal to the brain saying, gotta go. If it's a good time, brain sends a signal back to the bladder, telling the bladder to contract, pelvic floor to relax in order to empty urine. Pelvic floor is super important in this process, especially when it comes to holding urine in and letting the urine out. So we need these systems to function efficiently in order to avoid urinary incontinence and leaking. So next week, we're going to be discussing the different types of incontinence, factors that contribute to or exacerbate incontinence, and some ways that we can be checking in with our pelvic floor in order to set our body up for success and to keep our pants dry. So thank you for joining me today to learn a little bit more about how we actually pee. And again, next week we're going to kind of talk about what disruptions in that system can look like and what we can start doing in order to take the first steps to stop peeing our pants. So have a great day and happy Valentine's Day. And I look forward to checking with you guys again next week.